Hi, everyone. Welcome back to See the Invisible, Living with an Invisible or Rare Disease. My name is Rhonda Franny Jefferson, and thank you so much for taking some time out to listen today. I really appreciate the fact that you clicked on this podcast to listen to. I know that there are dozens, if not hundreds, out there that you can choose from. So I really appreciate the opportunity to spread some of my experiences, my hopes, and just hope that everybody listening gets something out of it. If you're new to this podcast, thank you again for taking the chance and listening. To tell you a little bit of what I hope to do, I just want to spread some support, some positivity for anybody who lives with a chronic illness or an invisible illness, especially, and also for those who care for them, their support system, whether it be family or friends and even medical staff. Especially in this time right now, I really think it's more important than ever to have a feeling of empathy and understanding and know that there's someone out there who supports you for being you and supports all of you. I will say I lucked out. I have a wonderful husband who we weren't married before my diagnosis, but he stood by me through everything. So I know how it is so important to have at least that one person in your life who's always there to stand by you and support you. And I've been fortunate enough to have friends and family who are there too. So I just hope to spread some of that to those who are going through these types of illnesses. Before I go any further, I do just want to provide a disclaimer that I am in no way a medical, insurance, or legal expert. If you do have any questions regarding anything in those fields, please make sure that you reach out to a doctor or your insurance specialist or the appropriate person for that. So last week I spoke some about self-care and how it is important to take some time out for you. Self-care is not always about being pampered or going to a spa. It can just be little things that you do throughout the day to re-energize yourself or to let yourself know that you are worth it. Prior to that, I've been working on going through a list of things on how to be your own medical advocate. And to recap some of those areas, I discussed the importance of communication, such as if you have questions, make sure you're writing them down. Don't be afraid to communicate openly and freely with your doctor, as that type of relationship is really beneficial. And also to know how your insurance works. At least in the United States, there are a number of different types of insurance. And then even within those types of insurances, there's different deductibles, out-of-pocket costs, depending on what the exact parameters are that you have with that insurance plan. So it's important to know exactly what you can do within the confines of insurance. The article that I was referring to, which I will link in the description of the podcast, only had 3 other items listed, but those were very short items. So I'm going to go through those 3 within this podcast. One was keep your records. This may be getting a little easier to do as many, if not all, doctors are moving forward to having electronic records. I know even 5 or 6 years ago when I would go to my primary care physician, she would bring out this file and it was huge. For one thing, there were periods of time where I was going to have multiple tests done, everything like that. So she had all of those records in this huge file. And sometimes I would just happen to see someone carrying a different person's file, and I'm thinking, okay, theirs is like 1/10 the size of mine. But that shows how important it is to have those electronic records, to try to find something in this big binder or this big folder, if you needed to find it quickly, would be very hard to do. So again, thankfully, there's most, if not all, medical practitioners are moving over to that electronic record keeping. Most do have some type of patient portal now, where you can go online and keep track of your medical records. And I find this is important too because you get a chance to review them where you're not under the restraints of, having a 10 or 15-minute doctor's appointment. You can actually sit down and review them. And if you come up with a question, you have a question there that otherwise you wouldn't have thought of. So it's important to review those records for yourself. It will also help you determine if something was missed, such as if you and your doctor had discussed a certain topic and that item was not covered or listed in the notes. You would be able to follow up and see why, and make sure the doctor actually heard you and understood what you were trying to say. The next item in being your own advocate is to review your medical bill for errors. In that article that I was using for this, it mentioned that about 80% of medical bills actually have some type of error. It could be just a very small error, or it could be something really major that could affect whether or not that claim is paid. I just know from my own personal experience, I've seen a lot of what's called coding errors, and that's where there's a certain standard of medical codes that need to be used when items are submitted to insurance companies. And insurance companies can be very exacting for that. Many years ago, I needed some reconstructive surgery on my legs, and it was not for vanity, it was not for cosmetic reasons, it was actually to help me be able to function better. But when the doctor's office put it through, they coded it incorrectly as a cosmetic surgery, not reconstructive, in that I'd had some type of illness or medical condition that caused this, and I needed to have this surgery. They looked at it as, okay, well, this is cosmetic. Then when it was resubmitted as reconstructive, they denied it. The surgeon explained to me that usually if this does happen, insurance companies just look at it and think that the doctor's office is trying to just change the coding and try to get the procedure approved. So that's very frustrating then for the patient because, in this particular case, he couldn't do the surgery because insurance wasn't going to pay for it. I actually was very, very lucky, and a few doctors donated their time. It was one of the original doctors who had been working with me, and he donated his time. His wife was an anesthesiologist, and she donated her time. One of his colleagues to help try to get the procedure done more quickly donated his time, and there were really a lot of people working together to try to get this done, which I really appreciated. But it all came down to a medical billing error as to why so many different people had to really work together to get this surgery in place. And the reason a second surgeon was added to donate his time was because of the cost of using the actual operating room. Having another surgeon in there would reduce the amount of time needed so that the charge for the operating room wouldn't be quite so high. Another reason to double check your bills is to make sure you're getting everything that your insurance affords. What I mean by that is, as different people have different plans, if there are errors, it might be taking away from what you're actually due. In my case, actually, when I've had an experience with this, I was actually on the receiving end of what would possibly be benefits, but I did call the insurance company to try to correct it. In this particular case, and I admit I had not looked through my bills previously, but I was going through a period of time where I was having a lot of tests done and was getting a lot of bills, so I thought, okay, I really need to start keeping track of these things. So all of a sudden, I started getting emails about claims submitted to my insurance. My insurance company would send a notification whenever they received a claim, and I started seeing these claims for a hospital that I had no idea where they were located. I live in a relatively rural area. There's just a few hospitals around. This was nowhere near us. And based on the claim, I could actually tell everything that was being done. There was, an emergency room visit. There was dialysis. There were all these tests. And they were pretty, detailed in the insurance claim. And this started to run into the thousands and thousands and thousands of dollars. And I had not received any bills, so it didn't look like I was going to be billed for it. But I did reach out to the insurance company, and I did not plan on spending the next 2 hours on the phone, but I did. And what had happened after we went through everything and were able to get information without actually violating HIPAA policies, which I found kind of amusing because I was getting medical information on someone that I didn't even know, is that someone with the same exact name as my husband, first, middle, last name, as well as the junior, and the same birth date, had been taken to a hospital in Tennessee, which is nowhere near where I live. It was an emergency. He didn't have his card on him, and I guess medical billing, they can go into certain things and get insurance policy numbers, things like that. So they put in his name, birth date, and that's what they were submitting. Now, I do have a high deductible and high coinsurance. So to have all of these items submitted on my insurance would actually allow me to meet, those numbers more quickly, and therefore, I would be able to have more things done without worrying about how much it was going to cost. However, I really thought about it, and I didn't know what type of insurance this other person would have, and thought they might not be getting their full benefits, because if they have an insurance plan with a lower deductible or lower coinsurance, or maybe even none at all, then they're not getting their full benefit. And that's not really fair if that's the insurance that they're paying for. So it took a while, but everything got corrected. But that's why it's important, where possibly from his end, if he were able to look at his bills and notice, why isn't this being paid when it should, then he would contact his insurance agency or his insurance company and not just pay them directly. Another reason it's important to look at the bills that you receive is to question whether or not they are being paid. At least as of a couple of years ago, when I had a similar instance, the doctor's office could charge up to 2 years after a certain procedure or a certain visit, and they had not received the payment from the insurance company. So, and I'm not alone in this. I've had friends, colleagues, family who've gone through similar experiences where a year and a half or more later, they get a bill, and what's happened is insurance has denied it, and it's now their responsibility. Even if it's the doctor's office fault, say a wrong code was used, the patient can still be held responsible. So I was actually told at one visit that they wouldn't be able to see me if I couldn't pay it. And that was kind of a shock, because I pay the bills as I got them. And, this was before, I mentioned that I didn't always take care of checking everything on my billing or on my bills. Well, this fell within that time frame, so this had never actually been paid, and in order to have my visit, I had to pay that. So just make sure you're keeping track that everything has been paid by your insurance company, and that way you can catch one of those errors earlier rather than later, because I don't think anybody really wants to be stuck in a situation where you're paying for something 2 years later. It's also pretty intriguing how every little thing has to be accounted for on a bill. Everything from even just Tylenol, which I'm sure costs the hospital pennies because they use a lot of it, or ibuprofen, things like that, very basic medications. But every single thing is itemized on those bills. So make sure that when you're reviewing them, there's nothing on there that doesn't look familiar. The last thing in the article that I was really using as a basis for being your own advocate was take advantage of free screening services that became available under the Affordable Care Act. Some provisions to that were if you were part of an insurance plan that you had before March 23rd of 2010, then those policies were grandfathered in and did not necessarily need to cover them. But with the Affordable Care Act, there are certain preventative medications or procedures that you could take advantage of. Just some examples for adults are immunization, blood pressure checks, and cholesterol checks, screening for colorectal cancer, and things like that. There's actually, for adults, at least 15 items that there's free screening for. Now, when I say free, it means you don't actually get the bill for it, but it's probably worked somewhere into your premium or some other costs that you may have, but you've already paid your health insurance premium. Make sure you're taking advantage of those. So there's 15 items for adults. For children, there's even more. There's 26 different services, and some are similar, like immunization, with some additional immunizations that are available, as well as screenings for developmental items, as well as autism. And that last one is something that's really, really important to me. My older son is on the autism spectrum, and I knew from about 18 months on that there was something going on. I was about 6 months pregnant with my second son, and I tried to get into the doctor just to try to get some information before I had the second baby. I wanted to have some things settled before then, or at least have some knowledge about what was going on. My doctor, or the doctor that he normally saw, was on maternity leave herself. So the doctor we saw was not as familiar and was just kind of like, it's okay. We'll keep an eye on it. I tried to see a doctor again about some things, and I think she was still out. And again, I was seeing a different doctor even from the first time, and just nobody was really familiar with him. Also, at that time, my insurance changed, and what was covered under my new insurance did not cover the same things that were covered by my old insurance. Now, this was all pre-Affordable Care Act. My son was actually diagnosed with autism. I don't want to say late, but it was longer than I think it should have been, because once the insurance changed and not as many things were covered, again, pre-Affordable Care Act era, then, we couldn't go back and see the same counselors that we were seeing. So it took longer, and because I wasn't aware of everything that insurance covered, I wasn't able to really get him in to see someone until I was at a point where I knew the deductibles and everything had been covered. But I did finally get an appointment for a hospital about 2 hours away for him to be evaluated. And compared to the response I got the first time when I had contacted them and they were talking about payment, it was just very curt, and it was almost like, well, if you can't pay for it, if you can't secure payment, then we're not going to be able to do the appointment. Later, though, I was able to get the appointment for him, and it was a very detailed evaluation, and it did confirm what I had thought. So it was very disappointing that it took so long to get the diagnosis, but that was an insurance hang-up. As far as the developmental progress of your children, especially make sure that you're checking with your insurance and see exactly what's covered, so that you can get a diagnosis for whatever the situation may be, whether it's autism or any other. Make sure you're aware of everything that your insurance has to offer so that you can get any diagnosis, whether it's for your family or yourself or whatever that diagnosis pertains to, earlier rather than later. What I did also find is that insurance can help you with things that you may not even think of. Again, going back to my son, I was having some problems with getting him help that he needed in school because where he is on the spectrum, it affects some of his communication, but not technically his learning. Well, most of learning is communication. So he was really struggling with a lot of things. And, I didn't think my insurance could really help with the school, but someone had suggested that I contact my insurance company anyway. I did, and while they couldn't really get involved with the school, they actually had an autism advocate who would discuss things with me, such as the requirements for educational plans, and also just provide certain resources to me. Even if they weren't necessarily related to the school, it would help lead me to resources that were. So if someone had never suggested I contact my insurance company, I probably never would, because it's not something I would have thought of, that speaking with my insurance company could help me with the school. But after I spoke with them, found out some information, I emailed the school and literally got a response within 30 minutes. And frankly, from then, it's been much, much easier. And it just took one face-to-face meeting with my son and everything changed. So that just shows the importance of checking out every single item that your insurance may cover or actually be able to provide resources for. I apologize. I think I may have said earlier that I was discussing the last item on the list, but there was actually one more item, which was knowing when to ask for a second opinion. What was really covered on that was to say that if you're concerned that your doctor's not listening, that they've missed something, then make sure that you do look for a second opinion. But the caveat to that is to make sure you do check with your insurance. Depending on the plan you have, it may not cover a second opinion. It may be one of those items where it covers a certain number of visits. And if you go to a different doctor, you might be beyond those number of visits. So make sure that you consult that. Make sure that you check with your insurance. So these were the items that were listed in the article about being your own advocate. Some things that I want to recap or kind of summarize on is communication is key, whether it's about this last item I talked about or just understanding your illness completely. Insurance is a big part of it too. I hate the fact that money is actually coming into play when it's a person's health and safety, but that's where we are, and that's what we have to be familiar with in order to make sure that we're getting our best care. And I know that many aspects of these items could be very monotonous or very boring. Let's be honest, they can be very boring, but they're also very important in making sure that you're addressing all of your concerns, whether it's with your primary doctor, one of your specialists that you might be seeing. You want to make sure that you're open with each person, and frankly, that each one knows what the other is doing. I don't mean that to sound, deprecating of either one of the doctors, but you want to make sure that nothing is missed in the notes or conversation, which is another good reason to make sure that you're keeping track of your health records so that you can be sure that each doctor that you're seeing knows about every other aspect of your health. Now, just a couple observations outside of being your own advocate that I made recently that may or may not have come up in your own personal life is right now with COVID actually causing increases in mail and shipping times. I myself, and I've known others who've run into problems with getting prescriptions on time. A number of insurance companies have certain types of what they call maintenance medications that you have to get through an online or mail order pharmacy, and with the delays that are happening with shipping, that can cause a big disruption in making sure you get your medication on time. I had 3 prescriptions in one order that sat in the same place for 11 days. This was just about a week and a half ago to 2 weeks. And even when trying to contact the insurance company and find out what I needed to do, I was getting different stories. Even though I had contacted them once by email, so I would have it in writing and I wouldn't miss anything, I was told when I called that information was incorrect. So, make sure if you can that you can order a little bit early. I know there's sometimes limitations on how early you can order, but that will allow enough time to get to you. And then if you do see that is taking longer than usual, reach out to the insurance company or pharmacy, whoever actually handles that process, to see what procedures are in case you don't get it in time. There might be some medications that if you miss a couple of days, it's not a huge issue, but others you may not be able to miss a dose of. So another thing I would definitely do is if you see that they're taking a lot longer to get to you, contact your doctor to see if they're not to you in time, what the effects would be. That way you're prepared and will have that information when you contact your insurance company or the pharmacy that's handling that. In my case, the pharmacy is actually part of the insurance company, or they're they're a part of one business or umbrella name. I really don't know. But I just know that they are actually somehow affiliated. So I'll probably use those terms such as insurance company and pharmacy interchangeably. But with the online pharmacy, even what I received was conflicting, or the information I received was conflicting. So try to start the process a little bit earlier. Also, make sure that you speak with your doctor as the COVID vaccines are starting more rollouts. If you are able to get the vaccine and you have concerns, make sure that you speak with your doctor before you have it done. Make sure that you cover everything. Again, I am not a medical expert, and I'll always defer to your doctor, nurse practitioner, physician's assistant, anyone that you go to for your medical services. But just overall, it's very important to make sure that you're informed on not only this, but any medication that you may be taking. Lastly, before I sign off, I am in the works of trying to get a few people to interview. I'll be trying to do a cross-section of different types of invisible illnesses, also perspectives from both the person who has the illness, as well as maybe their significant other or a family member that helps them, just so we're getting all sides. Now, first, before I do that, though, I need to figure out how I can, conference somebody in and record that to the audio software that I have. I used to be very technologically savvy, but this was years ago before technology took off at a very rapid pace. So once I get all of that figured out, then I will be able to get those interviews scheduled. I know I'm working on one with someone that I've known since college, and so hopefully we'll be able to get that done with her very quickly. And I'll also be trying to reach out to a nurse advocate at the local hospital who works with all type of issues that a patient may have. So I want to get their feedback on the types of items that they see most often, and what she sees are important factors for us to have the best hospital experience that we can have. I know no hospital experience is the best experience we can have, but it's not always the case. So just to get that perspective from someone who is working with the doctors and the nurses and other support staff in the hospital, to find out what they're doing to help support us, as well as what we may be able to do to help support them. I think it's important that we play a role in our hospital experience as well, because if we don't say what we need, the doctors and nurses and support staff won't know what we need, as well as situations where it might be some type of emergency situation and we're not able to communicate well. What are some ways that we can try to help that along, such as having a type of ID card or a list of medications, things like that we may have within our wallets or purses, whatever you carry with you. I did find some information on a website about an ID tag for those with invisible diseases. It would help designate or let someone know, especially first responders, that you do have a disability. However, I just did find that website before I started to record. So what I'm going to do is take a look at that a little bit more. And if I have any questions, I'll reach out to the contact on that site And once I have that information, that's when I'll go ahead and share it in the description of the podcast. I just don't want to share too much about it until I do a little bit more research. But I did find a lot of organizations that are out there to help those with invisible illnesses. So again, once I have some more information, I'll link that in the description. Again, I do appreciate you taking some time out to listen. If you have a chance, I know I've not mentioned it before about liking or giving a review to my podcast. If you do happen to be listening to it on a format where you can review, please go ahead, whether it's subscribing or liking it. I know different types of what's called a podcatcher that I've seen have different terms for it, but what that does is it helps, I don't want to say promote the podcast, but it makes it more visible for those who might be searching for this topic. So that way we can help reach more people. All right. Well, thank you again for joining me today. If you have any comments, please reach out to me at See the Invisible, SEETHEINVISIBLE 2020 at gmail.com. I also have a Facebook page, See the Invisible, as well as Twitter, Instagram, and a website, seetheinvisible2020.com. And I'm starting to work on a Pinterest board or a Pinterest page. So I will link all of those in the description as well, because of name availability. Some of the names are slightly different. So I think it's easier just to have the links in the description. That way you won't need to check for the different spelling and things. So, again, feel free to check any of those out, provide suggestions. I really appreciate that. And again, I appreciate the opportunity to be able to share my experiences and hope that everybody got a little something out of it today. Thanks. Have a good one. Bye.